Hi, my name is Singh, and I'm a fourth year at AUA, and I'm currently doing my rotations at Kingsbrook Jewish Medical Center here in Brooklyn. I was born in Brooklyn, raised in Queens. I lived in Queens my whole life. I went to high school here in Queens. I went to undergrad here in the city. My postgrad was also in Queens. I had heard of AUA from a friend who had went the prior year. I applied to the program, I did the interview, and I got in, like within a couple weeks. I love the campus, I love the staff. Even from Med 1 moving forward, Dr. Pai in microbiome, I love her. We're still friends on Facebook. Dr. Bharti is like everyone's second mom. She's so ridiculously intelligent. She knew the most recent information about bacteria and infections and things that were happening like in different countries. They grill you when you're on campus a little bit. You have fake patients that will have a pathology or a diagnosis that you have to assess. And then you have to do a physical exam and they kind of tell you, okay, Jean, do resp, do cardio, do GI, do nephro. I was given the tools to talk to a patient, how to introduce myself, how to walk into a room, how to be respectful to a patient, how to sit down, be eye level, don't stand up. There's certain things that you have to learn to kind of to talk to someone to make them feel comfortable, because you can be a nice person, but you kind of need the tools, right? So I did feel comfortable when I first started here in New York doing my rotations with patients. I did internal medicine first at Kingsbrook, and then I did peds at Interfaith. I was actually born at Interfaith Medical Center. And, my mom and I would talk about the day, and it was raining, and, everything that happened. And then it was crazy because when I saw that I could rotate there, I was like, oh, I definitely want to do that. Like, I definitely want to go back to where, I'm from. I really ended up loving OBGYN probably the most. Women are really smart, and I like hearing what they have to say and their stories and where they come from and where they want to see themselves, going with their future children. Right now I'm doing Hem-Onc at Kingsbrook. So it's basically hematology and oncology together. We have patients sometimes who were in remission for cancer and now they're coming back because the cancer came back. And then we have patients who just found out they have cancer for the first time. It's a really difficult rotation, but it's also a really hopeful one too, because we just had a patient. She was so full of life and she was talking about her breast cancer, and she found it herself and it went to her spine. So that it became stage 4 automatically. It goes to your bones. And now she's on a new medication that my attending put her on, and now she's in remission. So there are those stories too, where you hear these amazing things where you can really help. To have that ability to rotate at different boroughs in New York City while I was in medicine was really, really great. I knew in my heart I needed to become a physician. I knew that I needed to do this, and I just knew I needed the opportunity. I applied to so many medical schools in New York, and they all said no, which is taking your money. I took the application and the secondary application fee, but never an interview. The opportunities that I have now, I know it's because AUA took a chance on me, and I knew I had to prove myself. It wasn't like they just gave me a silver spoon. I had to work hard for it. I never took it for granted.